to those members of the public while streaming or watching this later by YouTube. I'm Hal Bulliston, Executive Policyholder for Public Health and Wellbeing, Leisure and Culture, and Chair of this board. I'll be assisted today by James Townsend as clerk for the meeting, and by Gordon Oliver, who is the Zoom host. I now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chair will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by a show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you, James. Do we have any apologies apart from Councillor Vickers? And I see we have Councillor Macros as a substitute.
Yes, yeah, those are the only ones tonight.
Minutes of the previous meeting. I picked up on one. I think there's a mistake on item 99, where Meriden was giving information about the vaccine rollout and saying 500,000 people have been vaccinated across Berkshire, Oxfordshire, and Buckinghamshire. Is that right? That is right. Oh, good. Better thought. Sorry. Any other items? Any declarations of interest from members? In that case, I'm delighted to present Katie Summers of NHS Berkshire West CCG to provide an update on vaccine hesitancy.
Thank you very much for inviting me to attend this actual Outbreak engagement board. So my name is Katie Summers. I work for Berkshire West CCG, where I am a Director of Operations for Wokingham, but I've also now taken up the overall responsibility and sponsoring for vaccine inequalities, not only for Berkshire West, but also for Buckinghamshire, Oxfordshire, and Bob Integrated Care System. So I'm here today to talk to you about our plans, about what we're doing at the moment of supporting vaccine hesitancy, but also to share with you some data about where we've got to in relation to the actual vaccine rollout, and taking a specific issue and looking at some of the inequalities data going forward. I'll probably start with that piece at the moment. So I'm just going to share my slide with you. There we go. So what I'm going to share to you today is some data that we've gathered from our GP systems. So we've used a system called EMIS, and the data that we've presented to you today is actually from the 12th. So this is from Friday, and it relates to the 4 days prior to that, because EMIS only gets data 4 days after they actually have been vaccinated. So please be mindful of that. So the data isn't necessarily the most up to date. It's literally a couple of days out of sync. It does cover the population of West Berkshire Council. However, please be noted that we are still waiting for 2 practices information, which are from Hungerford and Lambourne. They use a totally different clinical information system called TPP. But I'd like to assure you, moving forward, we are going to integrate that TPP information into this report. So that's just to make you aware. The information I'm going to share to you has been suppressed where we've got people that have been less than 10 or below. So also just be mindful of that. So what we've gathered here to date is that actually we're capturing 111,804 people, which reference around about 91%. The data we're capturing is only for the 18 and over. The decisions to make that for 18 and over is purely because at the moment, the actual vaccinations are not necessarily authorised for anybody less than 16. So it was decided that it would best to actually do this for the over 18s. So this is where we have at the moment. So please be mindful, this picture here is looking at the current status. This is the population at the moment of the people that have had their first vaccination. So you've got here 41,000. It's probably a lot more than that, given the fact that actually it's now 6, 7, 10 days out of date. So it's actually probably a lot higher now. And you've obviously got a smaller proportion of those people who've had their second vaccination. And we've still got quite a few people to actually still be vaccinated going forward. In relation to this, obviously West Berkshire is doing very well at the moment. You have actually vaccinated 39% of your actual populations of over 18 and plus. That's also incomparable to where Bob is at the moment, or Buckinghamshire, Oxfordshire and Berkshire West is, and obviously England is 43%. Now, the reasons why this is possibly slightly lower, as I was referring to, it doesn't capture the Hungerford and Lambourne practices information. However, I'm hoping in the next week or so, I will be able to get you the assurance that it's going to capture you all of the information. We then do a comparison of the age groups, and what we've done here for you is put down when the actual dates of those actual cohorts were actually picked up. So you've got here, for example, we know the 80 plus were actually started to be invited to their vaccination programme in December last year, and obviously last week we started now targeting the over 55s. So when you look at the actual RAG scores here, please be mindful that actually when I'm presenting, we're still doing the work, for example, of the over 50s at the moment. So where are you? You're doing exceptionally well. Well done for your over 80s. 97.1% of them have actually been vaccinated. That is a comparison to where Bob is, which is 91%. Equally, you're doing very well for the over 75s as well. The over 65s, that is obviously as well comparable, but we probably could be doing a lot more for that going forward. And I think this is where it comes into really thinking about equalities and the actual work going forward, because we know that lots of people who have lots of health conditions, or where they live, or where they actually are, their actual cultures, these people may be a younger population. So we now break it down into the ethnicity groups here. And what you've got here in front of you, I know it's quite a busy slide, but I'll try and explain this. So we've categorized the people of the white cultures, people of mixed cultures, Asian and British, Black, and then other ethnic groups. The little bits where you've got little stars, that's when it's literally the numbers are less than 10. So please be mindful that actually possibly you've still got numbers of people to be put forward in here, but these people are less than 10. So you can see here that actually we have a lower vaccination take up in some ethnicity groups and age cohorts compared with the white British. And that is particularly in relation to Black African, Black Caribbean, and the Chinese ethnicities. Now, I would say when I do this comparison across the whole of Bob, this isn't necessarily that you are unique in. Every area is experiencing this. We do know that actually we are needed to do a lot of work to target, especially the Black African, Black Caribbean and Chinese ethnicities. So what we're doing at the moment is we're working heavily with partners to engage with the communities, to understand and co-design initiatives to promote vaccination take-ups. And obviously, this is a key piece of work. I'm engaging heavily at the moment with your community engagement officer to think about how you can actually support that. And I'm delighted to hear that actually you did a lot of work a couple of weeks ago with your actual voluntary organisations to promote vaccine hatency and also help fact find. I don't like using myths busting. I don't think that's the right phraseology. What we need to be supporting is fact finding going forward. So the vaccinations at risk groups. So one thing that we're also looking at is the people who are at highest risk of COVID. So these are people such as those people with diabetes, those people who are obese as well. So we're looking at those people here about whether or not they're taking up the vaccine. So you can see here we're doing pretty well from that perspective. We're also looking at those people with underlying conditions, and obviously that's been targeted in cohort 6, which is actively being taken up by the primary care networks at the moment. So we've got some uptakes going on here, but we're still doing a huge amount of work to actually include that. That was a very big group, because if you look at that, that's 12,571 people. We've also been looked at those people on a learning disability register and actually making sure those are targeted, and equally supporting those people who are carers. We've also been looking at serious mental illness and housebound people. So there's a lot of work that's been taken forward on this and actually supporting the individuals. One of our GPs, Jim Kennedy, actually went out and vaccinated the team who are homeless in West Berkshire, and he did a fantastic job, and he's already still doing the work of targeting the homelessness in West Berkshire and making sure that everybody who needs to be vaccinated is being supported. And the final piece of information I want to share to you at the moment is we've got to be looking at people in the most deprived areas. So when we look at this, your deprived areas most notably are probably within the Thatcham Central Ward and also Greenham wards. So we've done a comparison here again of actually their uptake. And what's interesting here is the fact that we seem to be we're getting a bit lower figures when it comes to 60 to 69s. So obviously we need to be actually supporting those groups of people there and actually supporting actually getting them vaccinated. I can see a hand up. Do you want me to take that question now, Chair, or do you want me to carry on?
If you don't mind, is it relevant now, Graham?
Thank you, Chairman. Katie, yes, it's relevant, in fact, to the previous slide. I was perfectly happy to wait till the end. I'm happy how you want to play it.
Okay, I'll go. Let's go ask your question now. I don't mind.
Well, what I'm interested in this slide,
yeah,
is what is the definition of? I understand sort of what the definition of housebound is, but obviously here we have patients at high risk, underlying conditions and other issues. And then we have housebound. Now, presumably someone is housebound for a reason. And my question, therefore, is to what extent they're in the housebound category and not in one of the others, even though they would, if they were not housebound, be in one of the other categories. And just understanding and checking there isn't any double counting, because I could understand someone with a serious health condition who falls into that category is, as a result, housebound and sort of falls into that category. So I'm just trying to understand what we mean by housebound beyond they're stuck in the house.
Yeah, sure. So the reason why this is a separate category is because the primary care networks were asked to actually vaccinate anybody who was housebound in the first 4 cohorts. It's a separate category because we needed to make sure that anybody who was deemed housebound on their GP register was actually housebound. In relation to those people that are high risk, those people have been excluded that have been housebound. So those people have been excluded from that list there. So we don't have any double counting of those actual data there going forward. So it's a completely separate numbers and different patient cohorts. However, that's not to say that some of the housebound people probably are also those people that were at the highest risk of developing COVID-19. Does that explain that?
Well, yeah, it does to a large extent. I guess that, therefore, in the first 4 tranches, so the when it was, apart from NHS and care workers, it was purely an age category before they introduced the category 6 concept of other conditions over 18. Is it therefore right that a lot of these individuals categorized as housebound fell into that age category and needed to be vaccinated in-house because they couldn't get to a vaccination centre to have the jab?
Yeah, so what happened was before we went over to cohort 6, if I remember rightly, it really kicked off probably January time. The actual GPs were asked to actually go out and visit every single housebound individual, as well as Berkshire Healthcare Trust, and vaccinate every single housebound person. So it was a slightly different cohort. It isn't necessarily part of the cohort 6. The actual GPs were incentivized for this. They were given extra money to go out and do those housebound patients. So it's a slightly different ask. If you want, councillor, I will actually give you the actual information about and give you clear guidance about what they were asked to do, if that would be helpful.
Yeah, I mean, I'm interested in this whole process because, of course, you know, the care homes were in the early stages of this, and some of those elderly residents were housebound,
Yeah.
and they had an adult social care factor in there. So I was very interested in making sure that they were, we got out to them. I say we, the GPs got out to them to vaccinate them if they were prepared to have the vaccine. So yes, any information is interesting, but I'm sorry to interrupt you.
No, it's fine. Would it help actually? Because sometimes when we present percentages without knowing the actual background numbers, you don't really get a sense about the number of people this was looking at. If it would be helpful, I can actually give you the number of people that are actually deemed to be housebound in West Berkshire under the GP records, and we can probably break it down into those cohorts for you. Would that be helpful?
Well, I'm guessing it was, is it not 813, since that's the number at the bottom of the...
Yeah, it is 813. But if you wanted it to break, because it would be different, it would be different in the age groups. You see,
I understand. Yeah. I'm not looking. I'm not going to go that deep into the data.
Okay.
That's what Matt's there for.
Yeah, no, that's absolutely fine. Okay. Is there anything else then, Graham?
No, that's kind of you to answer that question.
No, that's fine. So on this data, what my team and a fantastic gentleman called Andrew Price, who works for me, he is going to now produce this level of data for you on a weekly basis. This is something that I've actually agreed and got agreed with Dr. James Kent, who's the accountable officer. This is the information that you could actually start sharing and actually publicising going forward to just demonstrate the work of the programme going forward. At this point, I'm just going to move forward and actually just talk about what we're doing for inequalities. So what we're doing is we've got 4 different cells. So we've got this data cell, as I've just presented to you. I'll stop sharing this because I'll get confused. So we've got a data shell, which is obviously supporting the vaccine inequalities groups, which is a wide group of partners. We have Health Watch there. We have the local authority representative there. Meriden co-chairs the actual meeting with me. We have public health there. But we have that group there who actually looks at the data, and we're also going to be actually now sharing that to each councils going forward. The second layer of this is very much about communication and comms engagement, community engagement. So one key piece that we're doing here is making sure that we're mapping all of the activities that are actually undertaken, that is actually already in place with regards to work that's going on in the actual local authorities to support COVID messages, but also helping with regards to the fact-finding of vaccination programme. We're talking about doing an actual survey as well. So again, it'd be very helpful if we could get that out, especially through yourselves, to actually ask residents of West Berkshire about their thought process of vaccination programme going forward. We're also doing work of trying to link in vaccine professionals. So the one key thing that we've identified is saying that actually when we're doing a vaccination, you need to have the information given to a specific group. So say if that's from the Black African or Black Caribbean community, it's got to come from a professional from their own cultures. So one thing that we are going to be trying to do is link up GPs, pharmacists, nurses, care staff who have actually given out the vaccine to actually promote to those actual community leaders actually information and how they could then promote the actual vaccination program themselves. The final thing that we're looking at is actually how do we support, therefore, organising targeted vaccination clinics. It's possibly, I mean, the work of the actual Newbury racecourse has been fantastic. It was obviously it was one of the late startups, but actually given the fact that where you've got to, they've done fantastic pieces of work to date, but not everybody, A, wants to get on a bus because they feel unsafe of COVID. B, do people feel safe to go into a mass vaccination centre? So one thing that we're looking about is organising pop-up clinics. So the pop-up clinics could be based into faith groups, whether or not that be temples, mosques, churches, community centres, which would be organised either by primary care networks or through community pharmacies, where actually local people could go in and actually be vaccinated. So again, that survey we're doing is going to ask them about where they would feel comfortable to be vaccinated. I appreciate I only had 5 minutes, so I'm happy to take any questions now.
Councillor Doherty, then Councillor Masters.
Thank you, Katie. And I just wanted to actually ask you to pass our thanks to Dr. Jones-Kent, because the granularity of the data we've just seen is what we've been asking for some time. So it's really much appreciated that we finally got hold of that and can share it publicly with everybody. I think it's really useful, and I think it's going to be an interesting piece of work, because what it does is highlight where we need to do that targeting, just as you've described. So by working jointly and having that information, it enables us to assist with actually targeting. So I just wanted to pass our thanks back to CCG for getting that data in the state it now is that we've just seen. So thank you very much for that.
No, thank you very much.
Mr. Masters.
Thank you, Chairman. Thank you, Katie, for a very thorough presentation. I've had a few people contact me about various issues, so if you could indulge me for a moment. With the non-clinically vulnerable going and being requested by the national scheme, there's been 1 or 2 cases where they've been asked to travel quite some distances, including one being suggested that they go to Old Trafford of all places, from somebody in North Newbury. That seemed, there's some stuff to be ironed out there. I just wondered what your thoughts were on how that can be eased up. But also, moving forward with the figures, we're slightly behind, as you mentioned, and that may well be to do with the Lambourne and Hungerford practices. What sort of numbers are involved in that, and do you think that'll bring us up to the national average? And we're pretty much on the money there.
Yeah, so Lambert and Hungerford, their population sizes, if I remember rightly, are around about 15 or 16,000. So you're going to be around about 30,000 patients that are actually we're missing out. So you probably will get up to that number going forward, I would actually say. I'm working directly with the system provider called TPP to enable us to get access to that information. So we will be able to get that forward. On your first query, that's a new one to me, Old Trafford. That's a bit far to go.
Absolutely, yeah.
I think the issue comes in there is when they go onto the national booking system, it will come up with a list of different booking availabilities. And so there'll probably a whole raft of things that come out. And probably that was probably one of those opportunities, which was possibly one of the nearest centres that actually had something that was available on that day. So you have to be measured in your actual how we do this. I think on the pop-up clinics, I think this is where it will come out. If we can do that survey and get that out to the local residents, and actually think about the areas that actually have maybe the most significant areas where we're not necessarily picking up the vaccination programme, or the most diverse populations, I think that's when we'll be able to really organise a different way of working. The one thing we've got now guidance on is, with this, what we can do is, if we let's take it from the point of view of a local mosque, what we can do now is that the imam of that local mosque can now organise it whereby they can invite their actual community to come into that mosque for a pop-up clinic. It doesn't necessarily have to go through the national booking service any longer. So there'll be much more local ownership of that national booking system going forward. So
when do you feel that'll be publicised and rolled out?
It came as guidance to us last week. I'm working tomorrow. I've got meetings with the Reading Primary Care Network GPs. I'm going to have conversations with the Newbury GPs, hopefully either later this week or early next week. And then I think once we get the details of how we want to take it forward, and I'm happy to hear from yourselves, I mean, where you feel would be actually the best place to do it. But I think what we're going to do is test it out in some areas in Newbury, first of all, to see how it would actually work. It's got to be organised and supported by vaccines that come through from the PCNs, because the vaccines will come through the primary care networks or from the community pharmacy sites. So a community pharmacy site is going to be going live in the Newbury, oh gosh, what's it called? The retail park. So that is waiting to, I think that's now being approved. So that's actually going live. one centre. So I think we could talk about it and actually think about where you'd like to actually go forward with a pop-up clinic to encourage this going forward.
Well, I think that's some way above my pay grade in terms of decision making, but I'm sure there's people in this meeting who we're going to action that. So I think that's a very positive step if we can take it to those communities that are particularly reluctant or being missed. So thank you for that, Katie. Thank you.
Yeah.
Councillor Macro.
Thank you, Mr. Chairman. I'm very interested in these pop-up clinics because I'm the member for Thiel, and you can't get to either the GP centre or the national centre, or even to the pharmacy in Tarnas, unless you've got a car. If you want to go by public transport, you've got to change. So it's not only a question of exposing yourself on the bus, it's a question of exposing yourself, it doesn't quite the right term, but you know what I mean. But also the difficulties of having to change transport systems and the cost of fares, actually. So I'm hoping that when you have these pop-up places, then you'll take that into consideration as well.
Yeah, no, thank you very much for that, Councillor Marco. I think you made a really good point there. The actual transport links from Thiel, I go drive past Thiel, unless you're on the train. Lots of people, what we're picking up is people just don't want to get on public transport at the moment. So we have to organise where they're wanting to take it forward. I live in a small village, so I live in Ashford Hill. There's no transport links here, and I look at it from that perspective, and I think, why can't I actually organise something literally in our little community hall? That would be easier to do, really. Yeah, thank you.
Meriden, I think I saw your hand up.
Yes, I can't find the little red one, I'm afraid. Yeah, I just want to make the point about people going to the national site and being offered lots of other places, not Berkshire. There will be a lot more vaccine coming into Berkshire this week and the coming weeks. So there should be a lot more appointments, which will make that less of an issue. But in the rest of Berkshire, there's quite a lot of PCNs doing vaccinations through their own practices, and they're not on the national system. So if someone goes on the national system and they can't get their local, they won't be offered a lot of the other PCNs. Now, PCNs are being offered the opportunity of all joining the national system. So we'll just have to wait and see if there's going to be any changes.
Yeah. I think also I just saw an email today that actually the NHS are going to be starting to text everybody about going along to do vaccinations. So I think there's going to be even more making sure there's enough both capacity and enough supply to support the vaccinations, because we're going into where the big cohorts are coming through.
I assume Councillor Bridgman and Councillor Masters, those are old hands? No, Councillor Masters.
No, it's a new one, Chairman. New one.
Councillor Masters, Councillor Bridgman. Oh.
I think Graham was before me.
Councillor Bridgman then.
Right. Yes, I was just going to give a different take on and following up what Meriden said on the NHS mass vaccination booking system. I mean, my wife and I had jabs a bit over a week ago. Got our letters, went on the system, were offered to put our postcode in. It offered us the Medeski as the obvious site. Had a whole load of dates on, some dates were blanked out, other dates weren't. Chose your date, chose your time. Bob's your auntie. It was very straightforward. So, I mean, certainly I did not experience being offered anything other than something very local to me. There were other sites available to me, and I could have chosen Basingstoke or various other ones going down the list. I chose Medeski because it's very, very, very easy for us. But my experience is that we were offered local sites with dates to suit.
Councillor Masters.
Thank you, Chairman. Just picking up on Meriden's point about more vaccines coming into West Berkshire. I know when we were a little bit late starting compared the racecourse compared to a lot of other local sites. Has supply been an issue locally? It sounds like that, when you talk about, more is coming on, and the expectation it was something along the lines that they've not quite had as much as they would have liked. Has that been a problem at the racecourse and across West Berkshire?
Meriden, do you want to come in?
Yeah, I was just going to say, I think they all wanted more vaccine, but we're no different to other areas. Everybody wanted more. Initially, there was a national restriction on how much came into the country, but there's actually a bigger supply. But I think Berkshire possibly is about a week behind in terms of being able to vaccinate the age groups, which isn't much, I have to say. I mean, it's in the scheme of things, it's not much. So I think everybody has been constrained, and some of our GPs could have had more. They could have done more if they'd been given more supply. So I don't think we were that different from other places.
No.
But we are getting, it'll be about 3 times what we've had before. There will be masses more appointments at the Majeski Centre over the coming weeks.
And be mindful also, the fact is now also those actual PCN sites are also now doing the second vaccination. So they're not only doing that 50-year-old cohort and up, but they're also now doing the second round of the previous cohort. So they're doing so much at the moment. It's unbelievable.
Councillor Doherty.
Just for clarity there, Meriden and Katie, my understanding is that we weren't constrained by supply. That wasn't the reason we started slightly later. It was because of a phased rollout, and we some of our PCN networks joined at a later phase to others rather than around vaccination constraint.
Yeah, you were right there. So the Newbury Racecourse was they were deemed a cohort 5. But it was literally only a week or 2 behind the other sites. It wasn't much at all. But again, taking Meriden's point, it still is being sometimes a bit constrained by actually the number of vaccines each site can actually get hold of. They would love to be able to actually vaccinate a lot more.
Yeah.
Councillor Masters.
So just to confirm, Katie mentioned about being in the the 50s cohort. Are we actually vaccinating over 50s now here in West Berkshire?
So you're vaccinating anybody over 55 at the moment. Okay. That's who've been offered the letters to actually vaccinate.
When do you anticipate the over 50s to be?
Meriden, do you know?
I can't give an exact date, but it'll be the next couple of weeks.
Okay, yeah. Thank you.
Shortly.
Can't see our hands up, so thank you, Katie, for a very good presentation, a very interesting one as well.
Who do I need to send this weekly report to? I'm trying to organise a way that actually you get it every single week at a certain time. And who would I need to send it through to?
Matt, does it make sense for it to be you?
If you can, thanks for the presentation. We can send it to myself and Andy. I think that'd be the best bet, I think.
Okay.
Thanks.
Thank you very much again. So moving on to care home guidance and Sarah Ross.
Hi, good evening. Matt Pierce asked me to come along to basically say what's going on in the care homes at the moment in West Berkshire. Obviously, I'm the service manager of our West Berkshire Council care homes, and so I can give you a sort of narrow narrative of what's happening within our care homes, but also do have a lot of contact with the external providers as well, but because I'm managing what's called an LFD fund, which is money from the government that's been given to ensure that care homes can test adequately and have the space to do that. So from the point of view of our 3 care homes that we've currently got within West Berkshire Council's control and management, the new visiting policy is now live. It's now out and available on the internet. We are now continuing visits with undertaking visits, and every visitor is having a lateral flow device test. So anyone that comes into the home, in terms of visitors, whether that be someone visiting a resident or whether people are coming in as professionals or contractors, they're all having an LFD test prior to visit. that's going really, really well. It's taking up quite a lot of staff time, as you can imagine, but we are able to manage that at the moment, even sort of having very strict booking times so that people basically book an appointment to come in so that we know that they're coming. So we are managing that. We so far across our care homes haven't had a single positive result from any of the visits, either contractors or professionals that are coming to the building, or the visitors themselves that are coming in to visit their relatives, their loved ones, which is interesting because we have done quite a lot. We haven't had those awkward conversations, which I think I was worried about in terms of our staff, about having to tell people that they were positive, and obviously the anxiety that can evoke in people. So that hasn't happened, which has been good. Our new visiting guidance runs alongside the guidance from government, which is very, very similar. It's obviously we based it on their guidance. So we now have a single named visitor for each resident. This has caused a little bit of friction, as you can imagine, because a lot of our residents have more than, generally we're talking about children, adult children of our residents, and obviously quite a few of the residents that we have in the West Berkshire care homes, as they do across all the care homes, have more than one child. So it has been a little bit difficult to manage, particularly with people that we look after who can't make those decisions for themselves. We've had to look at sort of mental capacity and best interests, which has been difficult to manage, but we have got through it. So those single named visitors are able to come into the home and actually have physical contact with their loved one. This is the first time we've had the opportunity to enable people to have that physical contact, and it's been really, really lovely to watch. The residents and their family members have been really kind and allowed us to take some photographs that they can then keep, obviously, and that we can have in our possession. I know I was asked whether I'd share some, but it just didn't feel right sharing them. But a lot of the staff have been in tears, I have to say. It's been really, really lovely to be able to facilitate that happening. The power of touch, I think, has been revisited on all of us over the past week or so. So that's been going really well. We've also got what's called the essential caregivers, which are people that undertake more personal care for their loved ones in care homes. And currently in our care homes, no one has actually taken us up on that. It gives people the opportunity to visit more regularly. And in terms of their testing and their PPE, they get everything that a staff member would get. So that would include having a PCR test, so the ones that are sent away that are deemed to be more accurate, but also an LFT test every time they come in. But so far, none of our residents' families have taken us up on that. I'm not sure why. They have all been made aware of it, but I think probably because they don't really see themselves as essential caregivers anymore. Whether that will change going forward, it may well. And in terms of the visiting across our homes, like I said, it's been a very, very positive development that we can now allow families to sort of touch their loved ones. I think it's initiated all sorts of feelings, I think, in staff and the families. Unfortunately, we have got some people with dementia who no longer recognise their loved ones, which became evident when we were prior to doing these sort of physical touching visits. But on the whole, they have been very, very positive, and I think both the residents and their families have found the whole experience very, very good and very positive. Sorry, I'm saying a lot of ums. So in terms of visiting, it's the fact that we are allowed to facilitate those visits where people can touch each other has I think it's been a really good step forward. I think that staff and the managers certainly were very anxious about whether that would increase our infection rates. I mean, we haven't got we haven't had any positive tests in the homes for a few weeks now, so that's really, really good. So it's been a really positive thing to do.
Thanks, Joe. That's really very reassuring, I think.
Mhm.
I can't see any hands up, so you got off lightly.
Just the one, Chairman.
Sorry. Councillor Bridgman.
Yeah, I was going to thank you, Sarah.
It's all right.
You and I have worked very closely on this on the policy. Indeed, we have. But I just wanted to just for the watching populace to ask you just to make it clear that obviously the single name visitor is very important, and physical contact is also very important. But it doesn't mean the rest of the family don't get to visit.
Not at all.
It just means they're not the one in the room holding hands.
Yeah.
They are still visiting in the way that we had set visiting up before. That was the only one I just wanted
They
to
are.
emphasize.
I think it has been a little bit tricky. You know, I want to touch my mum. No, I want to touch my mum. It has been quite hard to manage, but everyone's been great. So yes, but they are allowed to visit. So I think that's softened the blow a little.
Thanks, Sarah. Can we move on to
Thank
Matt
you.
then on to talk about situation report and instance?
Yeah, thank you, Chair. Let me just share my screen. So conscious of time, I've only got a few slides, and given the improving position, I just thought I'd just cover a bit of a snapshot really, which you're all familiar with to date. The summary slide here just gives the overall position for all the local authorities in Berkshire, and how we compare to the southeast and national average. So this doesn't include the most recent data that came out at probably 4 or 5 o'clock this evening. So we just have the local authorities listed on the left-hand side, the testing rates, the percentage of individuals that are tested positive, the cases per 100,000 for all ages, and the cases per 100,000 60 plus. So on the whole, West Berkshire is just highlighted in the middle. We're doing relatively well. Positivity rate at 1.5% now, which is down compared to the previous 7 days. The cases per rate, which was 29.7, I think it remains very similar with the latest data out today per 100,000. And then the cases per 100,000 at 17.4. So again, still a relatively stable and improving position. We are seeing some fluctuations in local authorities across Berkshire, and that's largely down where numbers are now getting quite low. If there are any significant outbreaks within those local authorities, that might increase rates temporarily, but the overall trend across the 6 LAs are in a downward position. And again, this graph just illustrates West Berkshire, which you've all seen before. So we've had 6,181 to date. And obviously there's been that downward trend as I've just talked about. And I think I've mentioned before, I think there will be another wave. I think it's not if, but when, and to the extent of what that wave looks like. But given the presentation from Katie earlier, we're hoping that vaccinations will have a big part to play, but we recognise that still a large number of people haven't been vaccinated. So really important to continue to follow the key government advice around hands, face, space, amongst all the other measures that people can take. And then I included this graph as well today because I think it actually just shows you how much our numbers have changed. So just on the left-hand side, which is the cases and weekly rates per 100,000, and this is from the latest week, which was 27th to the 5th of March. And previously, over the last few weeks, you'd noticed that actually with all the wards here, we would have seen a lot of numbers and bars, just given the extent of the number of cases we've seen. As you can see, actually, a number of our wards now haven't experienced any cases within that time period specified. Again, where there probably have been a few cases, that's likely down to some outbreaks within that particular ward. So again, really reassuring, and hopefully that trend will continue. The hospital activity, again, this is quite dated, but again, I think there's just an improving position in our hospitals. So that's really welcome. I won't go into that into much detail, but again, there's a slight lag in that data because obviously those people that might be seriously or might still be in hospital, but again, the numbers in total are going down. And then the deaths, obviously always the sad part of my presentations is to report that. So there's been 235 related deaths during the pandemic. Again, the data is a bit delayed because it comes from the Office for National Statistics, and 4 deaths in the last week, which is 20 to 26th. And you can see in the chart on the bottom here, which I always like to go over, we've got the rate per 100,000 on the left-hand side, the dates on the bottom, The grey bar represents the average over a 5-year period of excess deaths. And actually, as you can see throughout this wave, we've never really been statistically different than the 5-year average for the number of deaths we see this time of year, compared to the first wave, where actually we did see a significant number of deaths. I see Councillor Masters has his hand up, so I'm happy to take the question.
Thank you, Chairman. Thank you, Matt. I was going to wait until the end because it's a more general question about long COVID and what we're seeing across the district. But I can wait until you finish your presentation.
Okay, yeah, I'll finish my presentation. Sorry, and I'm happy to answer that. So in summary, that's what I was going to show. As I said, 6,181 confirmed cases, certainly a slowdown. And the key now is to keep those rates as low as possible. As I said, we will likely see a wave, but we're not quite sure when that will happen. It depend on a whole host of different factors in terms of vaccination, testing. Still really important that people maintain testing and get tests when they're eligible. And then the weekly rate stands at 29.7 per 100,000. And importantly, the rate for 60 and over has also decreased to 17.4. Again, that's really, really important, as we know that age group are affected more than most in terms of COVID-19, in terms of severe illness. This data is a bit out of date. I think the latest data that comes through publicly is around 45,000 people have actually been vaccinated with their first dose now. But again, that's changing all the time, as Katie talked about. So that's what I was going to cover. Thank you. So yeah, Councillor Masters, long COVID. Yeah, I know that that's an area of interest across West Berkshire and Berkshire. I know there's a new long COVID service that's up and running at Royal Berkshire Hospital. And I think you rightly remind me, I think often we just refer to deaths as the key outcome, but actually we know that many, 1 in 10 potentially people that have COVID suffer long COVID. So one of the conversations I'm having with Royal Berkshire Hospital actually is how we can develop community-based pathways, so people with long COVID can actually be supported by local groups in our community. And obviously the evidence is emerging all the times in terms of the complications that people get from having COVID. So I don't know if that directly answered your question, if you had anything specific to.
Yeah, I was just wondering if you had any data on current diagnoses or people that that they were working with at the unit at Royal Berks. And is there any, what evidence is it that the younger cohort seem to be disproportionately affected by long COVID? I know personally I've lost a couple of people who've been suffering from it quite recently, and since the middle of last year. So it is quite a serious issue, and I think something that we as a community need to be aware of, so people can get the diagnosis and the treatment and help that they needed.
No, you're absolutely right. I don't have any evidence to hand. I don't know if Meredith has any latest information. She's shaking her head, but I'm happy to bring that back maybe to the next meeting. So I know the lead for the long COVID service at the Royal Berkshire Hospital. Maybe we can get some qualitative feedback as well in terms of what symptoms people are reporting. And the other thing is obviously, and the other point is obviously, the indirect impacts of COVID, isn't it? We don't often cover that in the local outbreak engagement, but all those people that maybe haven't sought help when they've needed because they might have been frightened of getting COVID, how we kind of track that over the long term as well. So, but happy to bring the long COVID back at the next meeting.
I think that, Chairman, would be really good if we could timetable that into the next meeting. Or thank you, Matt.
No, Rose.
Sorry, just trying to get myself off mute, just to support Matt with the long COVID element. So that's something we've worked with Royal Berks about, setting that service up. And we're also hoping to set up some feedback across the whole of the Bob system as well, because there's different learning going on about long COVID at the moment. So actually working with colleagues in Oxford and Bucks, Deepak, who's the service clinical lead, is working across Bob to feedback some of the symptoms, because this is something, as Matt has said, we're learning as we go along, and it's quite variable what each of the services are seeing. So hopefully we can get an update, and just to give you a view that actually we're sharing this across Bob on a clinical basis to get some understanding around the effects of long COVID.
Thanks very much. I think that's reassured me a little bit. Thank you.
Yeah, I can't see any more hands up now, so perhaps we can move on to Mandip and the communications update.
Yep, sure. I'll be quick on my update. So a couple of weeks ago, we had a Facebook Live with Lynn and Matt, which took place on Thursday, the 4th of March, and that went down quite well. Lots of kind of engagement and questions that came through that live session, so that was good. We've been sharing information on lateral flow tests at the 4 testing sites, and also kind of for businesses. So we're encouraging the hospitality businesses to uptake the community testing, and we're also encouraging businesses to register with the government for the free lateral tests that they can get. They need to register before the 31st of March. We also had a budget briefing that took place last week, and that's part of our ongoing support for local businesses during the pandemic. The webinar was followed by an online surgery, which had free sessions for businesses, for business owners and managers to discuss kind of budget related issues as part of the pandemic. And a link to the webinar we are going to be sharing on our socials and in the newsletters as well to residents and businesses. This week we're looking at promoting Shop Local for Easter Bank Holiday, and this is basically just to kind of encourage residents about the benefits and opportunities and positive impact within their local community to shop local, obviously as things start opening up. Vaccinations, which I know has been covered quite intensely today, but just to really kind of show our support in making sure that we are also putting out information to people. So our website is being updated with information all the time, our social media, our newsletters, our FAQ section, and obviously when the new age categories are being announced, we're also promoting that to everybody across all of our communications channels as well. We've put together some information about free school meal vouchers to eligible children during the Easter holidays, and the details for those are being issued to schools and early years settings. And we're also working through the roadmap to recovery with the 4 steps out of lockdown. So again, continually sharing all the information that we have about that, but concentrating on sort of 1 step at a time so that it doesn't become too confusing for everybody. And alongside that comes a national campaign about not sharing false information. So we're doing some work around that as well. We've also been doing some bits and pieces for mental health information and what our COVID marshals are doing as well. And we've also been trying to work with the schools just to kind of encourage about sort of school bubbles and the need for the hands, face, space criteria as well, but at the school gate, but also outside of the school as well, just to ensure that the same message is being repeated and we're not going to kind of increase the risk of the spread, so that we don't kind of get into another situation again, basically. And that's probably most of the comm stuff that we're doing, and that concludes my part on there. Happy to take any questions.
Thank you, Amanda. It looks like you're being let off lightly this evening. Next item is future agenda items. I've already picked up on the chat from Matt suggestion of looking at the local outbreak control plan, and clearly we'll bring the long COVID issue to the next meeting as well. Does I see your hand up, Councillor Macrae?
There's a question about communications, actually. There seems to be quite a lot of confusion still about the roles of the national centres and the GP centres, and people expect when they get a letter from the national system, they go on and then they can't select the GP centre and they get confused. Is there something we can do about that? I mean, this has happened, in my knowledge, both with Newbury Racecourse and also with the GP centre at Pangbourne.
Is this to do with the vaccinations?
Well, the vaccinations, yeah, sorry.
Yeah, I think that was covered earlier on, wasn't it? About there was a question that was raised earlier about that one. But
it sounds like it's going to change, but at the moment, as I said, there have been people confused by this, but just wondered what we could do, basically.
Yeah, I'm happy to take that one away and kind of work with the CCG on that one.
Thank you.
Can I move on to any other business? In that case, I think that concludes the business of the meeting. Can I ask all panelists to remain in the virtual meeting room and not to leave until the host has confirmed the meeting is no longer being streamed, and to thank everyone for attending the meeting. Next meeting will take place on Monday, the 29th of March at the same time. And I wish you all a very good evening.